All right, so just like we've always been talking about hypertension, we have always gotten to establish that hypertension is a disease that most of the times you treat is medically. No need for, what do they call it? No need for surgeries, just drugs, lifestyle changes. But there are some times that you need to do a surgery for a patient that have hypertension. So we're trying to look at some of these rare scenarios. Okay, those are the indications. So, indications for surgery. Okay, so first indication is renal artery stenosis. So if the renal artery, the it's kind of like narrowed up or totally blocked, I'll have to do a surgery to release that. Do you understand? So indication most of the times if there's stenosis, if there's the narrowing is on two sides. So two of the kidneys are affected. I always want to do a surgery to relieve that. So procedure they can do angioplasty. Okay. So angioplasty they basically try to like cut out what is narrowing the blood vessel. You know. Then you can also have adrenal tumor. So it is an adrenal tumor and is leading to the secretion of a lot of aldosterone. I might just want to cut out the adrenal gland. That's what adrenalectomy. Okay. So all those tumors, they are catecholamine-secreting tumors. They cause a lot of headaches, a lot of hypertension, a lot of sweating, a lot of palpitations. There also another tumor known as what? The aldosteronoma. Okay. So it's an aldosterone secreting adrenal adenoma. It causes a lot of hypertension and hypokalemia. So the person will be retaining a lot of sodium and water, but will be putting out potassium. So there's low levels of potassium. Okay. So this one too, I can cut out the adrenal gland. That's what adrenalectomy. Okay. Then coarctation of the aorta. It is narrowing of the aorta and is usually congenital. So I can do a surgery to repair it or do a balloon stenting. Okay, balloon angioplasty with stenting. Then for non-functional or damaged kidney, where you basically just remove, if it's one kidney, you can remove it so that the patient thrives on one kidney. Okay, so that procedure is known as what? Nephrectomy. Okay, nephrectomy. So I think pretty much that's what we have for the rare cases where you need to do a surgery for a patient that has a hypertension disease.